Wonderful. We're all set. Thank you so much. All right. Oh my goodness. I'm just trying to collect myself for a very emotional experience. It was so beautiful. I just have chills radiating through my body. So what a great way to start this session, which I know is going to be incredible as well. We are here to talk about the immigrant caregiver experience and have three powerhouses here to present to us today, share their experience, perspectives, thoughts about how we move, really advance immigrant participation in the cooperative sector. So first up, we have Aquilina Soriano Versoza, who's Executive Director of the Filipino Workers Center of Southern California, an incredible person who is always doing more than I could ever imagine. Fatima Ramirez, who's a worker owner at Courage Homecare Cooperative, and we're so happy to have you here today and hearing from you about your experience. And then Vanessa Bransberg, who's Senior Managing Director at the Democracy at Work Institute, DAWI. So I'm going to turn the floor over to Aquilina, and thank you all so much for being here for this session.
Thanks. Let me unmute and get the right screen up. Good morning, everyone. Magandang umaga sa inyong lahat. So just so you can see cute pictures of the panelists and so what we're talking about is the immigrant experience and specifically home care cooperatives for immigrants. So in the home care industry and home care, the field of home care and long-term care overall, there are actually, we all know that home care is critical and is a critical need here in the US, but there is also a global trend of home care needs around the globe. Developed nations or first world nations around the world actually have aging populations similar to the US and lower birth rates and resulting in the need for actually immigrants to fill some of the gap of those who can actually provide long-term care and home care overall. So from Japan, we see immigrants from all over Asia actually coming into Japan. They shifted their very tight immigration policies to meet this critical need. There are many Filipinos working in Japan, filling this need. In England as well. I've talked on the ground with organizations there, and in parts, if you ask, do you have a Filipina? That means, do you have a caregiver? And that's just shows you how many immigrants and Filipino immigrants particularly are actually filling this need. I just wanted to know in Africa, it's really interesting that the immigration patterns are within the continent. So like South Africa has immigrants coming from around the continent to South Africa to actually provide home care to those in South Africa. So, and in the US, this is very true, that immigrants are also filling this gap. In 2017, 23.5% of both formal and informal long-term care sector workers are immigrants. And we know this is probably an undercount because of how many are not captured in the informal sector of providing one-on-one care in individual homes. And through the National Domestic Workers Alliance, we've seen a large trend that as the baby boomers are, coming into retirement age, with this explosion of the need for care, and especially care in home settings and in communities, we all know that everyone, almost everyone prefers to age in their own communities and in their homes. And so the need for home care and home care workers has grown exponentially. And one trend that we've seen is that domestic workers, even if they're housekeepers or childcare workers, are also being asked to step into the role of elder care workers as well. And so because of the, also again, lower birth rate of the Native population, as well as a low investment in the long-term care infrastructure of our nation, it's made it very challenging, right, to be able to really provide as many home care workers as needed from the Native population. And so immigrants often are filling this role, but they're not coming in specifically through home care visas, which there really is not that pathway. They're coming in through different visas, but then move into the informal sector as home care workers. And the conditions for immigrant caregivers, you'll get to hear the story of Fatima and her own journey and her own experiences. And it's very representative of what we see overall for immigrant home care workers. So immigrants, especially undocumented immigrants, although not only, are often working in the informal sectors and face high rates of wage theft. It's actually very rare that we find someone who is being paid what even minimum wage with overtime protections. Many of them are working in unsafe working conditions because their sites are other people's homes. Then you know, there is, and it's in the informal sector. Many times they are working around the clock, sometimes as the only caregiver for weeks, sometimes months, which is very wearing on both the physical and emotional health of caregivers, because not only, you know, well, not only are they there 24 hours a day, but we did a study on sleep. And if you are on duty or you are a live-in worker, your sleep quality is much less than someone who is off duty and in a space where you can really fully rest. And this has both short-term and long-term impacts on the health of the worker themselves, and is very unstable. Once your client passes away, often you're losing both not only your income, but as well your living situation as well. In California, it's common for live-in immigrant home care workers to be paid $5 or less per hour with no overtime. And we've seen cases as low as $2 per hour with no overtime compensation. So Filipino Workers Center, we didn't start as a cooperative developer. We really were seeing how many caregivers there are in our community and seeing the conditions that they're working on. And we really are dedicated to transforming the industry. And so we started with leadership development, policy campaigns to just establish basic rights for home care workers, like the California Domestic Worker Bill of Rights, which ended 75 years of exclusion to overtime protections for home care workers in California, only in 2014. And then wage theft enforcement programs and campaigns, because even if you have the rights, if you aren't actually able to realize those rights, it's kind of useless. So as well as workforce trainings to provide support and skills and leadership development to home care workers who traditionally are not able to access those kinds of programs through the government. And then one program that then developed was Courage Home Care, the Courage Home Care Cooperative. You know, as we have such a large pool of amazing home care workers, And then as we started to develop out our coalitions with communities that are hiring home care workers, we were able to really see that courage could be a real high road model, an example of how home care workers can actually be paid what they should be paid, and really build democratic, institutions that are providing work conditions that are dignified and really have the respect that they deserve. We had many roadblocks to building this because many of our members don't have working authorization. So there are, in the legal structure, co-op members, as we were trying to develop it under an official co-op structure, not an LLC model, you had to have a social security number in order to actually be a member. So that automatically denied access to a majority of the workers that we were working with. So we started learning about innovations that were happening in the cooperative movement, about alternative structures that really would open up the accessibility to immigrants, like the cooperatively owned LLC model. And Vanessa is going to talk more about that later. But this is a trend that's happening so that the cooperative model can be a solution also for immigrant workers in not only home care, but other industries as well. So I'm going to actually pass this to Fatima now. Fatima Ramirez is one of the Courage worker owners, members, and she's going to share more about her own story and also introduce Courage to all of you. And please welcome her. This is her debut as a public speaking for Courage. And so we're so happy that she's able to join the panel today. Fatima.
Unmute.
Unmute one more time.
Okay.
Perfect.
How's that? Okay. I have to turn on my screen here too. So good morning, everyone. Again, my name is Fatima Ramirez, and I am originally from the north of the Philippines, the summer capital of the Philippines, Baguio. I studied nursing in school, but worked many different jobs in the Philippines. How I came to the US is a bit different from others. As my story goes, I became a single mom after my marriage failed, which means support for my disabled son and family are on my shoulders. Labor has been introduced to me though, as long as I can remember, even as my own grandfather was receiving monthly pension from US government as a veteran. But like others, I sought greener pastures abroad. So I sacrificed to be far from my children to provide for them. I had been working in a sports boat, guiding tours in Caribbean, and had traveled through the US, like New York, Texas, and Florida to get there. And due to some technical problems, paperwork, I was not able to get back to the Caribbean and was stranded here in the United States. But I had to work for my continuous self-support. And here in the United States, I have worked as caregiver for over 10 years. I have to learn to do it right. I got my training at a small but several residential care for elderlies. I was making only 1,500 a month for working around the clock, caring for 6 to 18 patients, individuals. I then moved to do caregiving one-on-one. That means I take care one patient at a time now. I worked through agencies and was also directly hired, but I worked as a live-in caregiver where I work 5 to 7 days a week around the clock, mostly lightly sleeping next to clients to help them respond to any needs throughout the night. I earned 400 to 600 per week though, which is just over $3 to $5 per hour with no overtime, no sick leave, and of course, no pay for any leave, or the common saying, no work, no pay. In 2017, I became a member of Courage Homecare, which is the cooperative. And this time, for the first time, I experienced earning as a caregiver with all of my labor rights intact. We would mostly work in shifts to be able to provide 24-hour care for clients who need it. But because of the pandemic, I am working 3 days a week around the clock. But now I earn over 5,000 for working 3 days with overtime compensation. There is more than I was making in 3 months for working 5 days a week. I'd like to introduce Courage Home Care to you all here at the convening. Courage Home Care is a state licensed home care agency here in Los Angeles, California. We became our own independent entity in 2015 as a limited liability corporation where all workers are also owners and earn as owners. Currently, we have 10 Coop members, which has been our consistent membership over the past few years. Our customers all come from the private pay market, most of whom need 24-hour round-the-clock care. Some pay out of pocket and some have long-term care insurance. For each client, we are able to have 3 to 5 members assigned with a mix of part-time and full-time positions. Most of our contacts with clients last through the life of the client or until home care is no longer an option due to higher levels of medical care needed. Currently, we are looking to see how we can strengthen our operations so that we can grow our co-op with more clients and grow the number of co-op workers, owners. Two of the challenges that we face as an immigrant home care co-op is that we cannot use governmental workforce funding for training and workforce development because most of our members are not eligible to be recipients of workforce programs. Another challenge is that for this structure, members must earn as owners right away. So we are not able to onboard members as workers first before becoming owners. We are still trying to design a good onboarding process that lets us get to know if a prospective member in the co-op is right fit for each other. I think that's all that I can say. Thank you so
Thanks,
much
Fatima.
for letting me share.
So we're gonna pass it over to Vanessa, and I'm stop sharing so that you can share.
Okay, thank you. And I think Isabel is going to share my presentation. Wow, that's very inspiring. Thank you so much, Fatima, for sharing your story and some about your cooperative.
Thank you.
Yeah, it's incredible.
Thank you so
I'm very
much.
moved. So I'm here today. I was invited to talk about some of the innovative approaches that are happening around the country to be able to create cooperatives that can really build good livelihoods for immigrant communities. And so I'm really happy to be here today and to have accepted this invitation to talk about immigrant-led worker cooperatives. I mean, go to the next slide. Just a little bit about me briefly. You know, I'm also an immigrant and I came from Argentina when I was 7 with my family. And I landed in the worker cooperative field about 13 years ago, even though I'm a trained social worker. I was sort of brought into it in kind of a strange way where I became the program director of the Cooperative Development Program at Center for Family Life in Brooklyn, New York. And so I really got all my training there. By being on the ground with folks in Sunset Park. And so since 2015, I've been at Democracy at Work Institute, where I really was interested in expanding my experience on a national level, in particular focusing on working with immigrant communities to scale worker co-ops and to make it a larger impact, right, on workers, families, and really not just here, but abroad is what we're seeing. And so you can actually go to the next slide. Thank you so much. So DAWI's mission is really to expand democratic business ownership to people locked out of good jobs and ownership opportunities. And so we particularly focus on low-wage workers, immigrants, and communities of color. And we were formed right out of our sister organization, the U.S. Federation of Worker Cooperatives. And so we work very much aligned with one another to grow the field, basically. Next slide, thank you. And so today I'll cover 3 different things. First, some general trends that we've observed about immigrant-led worker cooperatives in the United States. Secondly, some challenges that we have seen that are being experienced by immigrant worker owners and developers working with them. And thirdly, I'll be talking about the Rapid Response Co-op Development Project that DAWI has been leading with partners around the country for the last 3 years, really piloting it. So those are the 3 things. Next slide. So just to start off, giving you some context, right? The Federation and DAWI conducts an individual worker census every few years. And so in 2016, we saw that about 1/3 of the workers that responded to the survey were not born in the United States. And so what this tells us and what we have seen is that the immigrant-led worker cooperatives are the fastest growing sector of worker co-ops in the country. So that's really important information. It's obviously being utilized at a fast growing rate. We see that cooperatives led by immigrants are primarily in the service sector, focusing on catering, childcare, and cleaning. However, from what you see in the slide, there are a bunch of other sectors or industries, that they are in. That they're concentrated in. We do know that most of the immigrant-led worker co-ops are being supported by developers, and those can be worker centers like the Filipino Worker Center, nonprofit organizations, or even individual consultants. And developers, we know, often invest financially in these co-ops and during the startup phase in particular. They provide training, technical assistance as the growth happens. They help to access markets, and they mentor the co-ops, and oftentimes even serve on the board of these cooperatives. Next slide. So I'd love to just like mention, what some of these co-ops are, just to give them some like a face, right? And I'll be focusing here, particularly here in New York City, because they do have a really high concentration of immigrant-led co-ops, in large part because of the investment that the City Council there has made since 2014. And so the large amount, the large part of the worker co-ops that have been created since 2014 and even before are led by immigrants and people of color. And so some of the examples include Beyond Care, which I was part of the founding group, who is a childcare cooperative. They've been around since 2008. Of course, Cooperative Homecare Associates that we all know, the largest worker co-op in the country, very much led by POC and immigrant women. Mangaing Cleaning, a Filipina-led business, doing commercial cleaning mostly and some residential. Golden Steps, that I also got the pleasure to work with. It's dedicated to elder care. And another one I'd love to mention is Trusty Amigos, because it's fun and they do pet sitting, also mostly by young immigrant participants or members. So in the next slide, I'm going to be talking a little bit about challenges that have been seen by the field, by developers, by worker owners, and just folks, kind of providing supports. So the first that's mentioned here is that despite conferences and efforts to bring immigrant co-ops together, I think there's still somewhat of an isolation that's happening. And therefore, what happens is people are starting from scratch oftentimes, creating their own tools, their own curricula, really maybe not accessing, legal services or other kinds of TA as necessary by drawing on other lessons, other folks that have done the work already. Relatedly, many of the co-op developers supporting these co-ops are still oftentimes under-resourced, even though there's been an increase in philanthropic support, for example, for worker ownership development. It's still not enough. And so, folks are just trying to figure out how to support the capital and their time, their capacity to support these co-ops. The third item here is about the legal form. And so, some of what Aki was mentioning early on is that, many immigrants, as we know, are not able to participate in the traditional worker cooperative structure, which we have many, right? Many are formed as cooperative corporations, if it's possible in their state or in other ways. And so what we've seen is alternate forms being created to give accessibility to people with barriers to work, such as lack of work authorization. And so one alternative legal form that we've seen for more than 2 decades really is the LLC member managed or limited liability company, right? And so this has been really a great way, I think, for folks to organize. And I'll be talking more about what that means and why they're organizing that way. But we're still seeing that some of the challenges from using the LLC form is that it's been recommended to maintain it pretty small so that really people in the co-op, all of the members are board members, are really owning and managing and controlling all of the decisions. And so the scaling strategy ends up being replicating those co-ops, right? Keeping them small and making many of them rather than getting large. So just something to think about, right? The last challenge that is listed here is that we see that even though, I was mentioning earlier, there's been an effort to sort of have a lot of peer-to-peer learning. The Federation leads one of these groups, for example. There's still, I think, ways to go for the immigrant-led co-ops to be more united and cohesive, in terms of sharing lessons learned. Next slide. So just to go into, what I was mentioning and kind of in the third challenge a little bit more, when we look at the most fundamental issue, right, that immigrants face, we know that not having work authorization is a barrier to employment for highly skilled and qualified workers. They can't be employees in this case. They can be independent contractors, and that's a very common way of working. However, for many, it can be challenging to manage your own business, to make sure you're doing your taxes appropriately, and to manage your clients, and to really advocate for yourself, and have a contractual relationship that makes sense. And so the third thing that we're seeing is that for immigrants that do go to college, fellowships are an option too, to provide some financial support, but those fellowships end eventually. And so what happens? You can go to the next slide. We know that there's another way, right? Which is these folks that are having these barriers being owners. And so in 2017, DAWI really became interested in drawing from all these learnings from the field of more than 2 decades of LLC member managed immigrant-led co-ops. And so we were interested in responding to the need to connect to good work in a quick way for people with barriers to work, right? Not really take the whole maybe year or more to create these co-ops. And so we started creating a toolkit that could be accessible to various institutions, cities, and community-based organizations who are interested in replicating a worker co-op model that would serve their members and constituents and would be relatively easy to set up. So this drove us to create the Rapid Response Cooperative Development Program, which essentially uses a franchise-like model to create worker-owned cooperative staffing agencies called Radiate Consulting that are member-managed LLCs, where the members are owners. And so the way that this works is we don't do this on our own, we partner with community-based organizations, universities, and cities to replicate these RRCs in their geographies or industries, licensing the model and networking the cooperatives at formation for shared services and benefits. And finally, we connect these co-ops to a member-led movement, right, for worker co-ops. The U.S. Federation of Worker Cooperatives is one of those. And so as you see here in this slide, the co-op, Radiate Consulting, really serves as a legal buffer between the worker and the client. And so this type of affiliation makes a working relationship possible while protecting the workers. So in this image, you see that the Radiate member is on the left and the client is on the right. And so when the worker joins Radiate, the client organization uses Radiate services, right? They're not contracting directly with the member, but rather with the entity. And so this can create access, this can provide more access to business owners and, in terms of income stability and access to benefits. Next slide. So in this photo, we actually see, these are the founding members of Radiate New York City, one of our first Radiates. And most of these folks are recipients of the CUNY City University of New York Mexican Studies BECA Scholarship Program. So far, we've partnered with 3 institutions, CUNY to build Radiate New York City, the Office of Civic Engagement and Immigrant Affairs in San Francisco to build Radiate Bay Area, third, Cooperative Santa Ana in Southern California to build Radiate Orange County, who are contact tracers right now and doing community outreach and education. And then most currently with Code the Dream to build the first tech Radiate in North Carolina in rural regions. So just to give you kind of like a broad overview of what a cooperative like Radiate, a rapid response co-op would entail. Again, it's a business structured as an LLC, which means that the workers have limited liability, right? If there's an issue, they can't, the client can't go after their own personal assets, and so they're protected, and they work as partners or owners. It has shared ownership, which means that the members are highly autonomous. They're responsible for governing the business and assuring that the operations are effective. And of course, they operate by a set of the principles, the 7 international principles that we know of. And they are responsible for investing in the business. It's $500 capital contribution within the first year based on what they're earning. There's a percentage that goes towards that. And if they can't do that $500, then we talk through that and make an alternative plan. And of course, the cornerstone of worker ownership, one member, one vote is a part of all of this, of course. Even if you haven't put in all your capital contribution, you still have your vote, of course. And lastly, the structure part is really important, which is that there's a member administrator who manages, or a couple of member administrators who manage the back office. So that is the billing, the invoicing to clients, the tax filing, contract creation and management, all of that, so that the members are alleviated from that and can really get the support that they need and get paid on time. Next slide. So another thing to mention is that these co-ops are not being created in isolation. They are joined from the very beginning into a network. And so what it means to be part of this network is that you utilize a license agreement that DAWI manages for the Radiate Consulting trademark. So this is a shared brand essentially, which means that there's quality control and risk management. Alongside that, there's vetted messaging in case you want to, for your marketing purposes and speaking to the media, for example. There's active professional development happening, which are trainings depending on what the members are wanting to learn, as well as coaching, one-on-one coaching, like professional coaching. So there's other things that are mentioned here, which we're working towards, for example, building out more and more benefits like health benefits. And this is through, again, the U.S. Federation of Worker Cooperatives so that the members are able to access what they need. So we're starting out with vision and dental and gearing up for other kinds that the members are going to be requesting. And so the next slide it really talks about just going back to the different kinds of services that are being provided, and this is where the Filipino Worker Center comes in. The areas that the members are providing right now are listed there. However, we're seeing that we are really interested in kind of using the form, the RRC toolkit, not just to work with consultants and folks coming out of college, which has been some of the projects that we've worked on, but also, contingent workers and members of worker centers who are doing different kinds of work, like community, promotora work, for example, to be able to set up quickly and using these vetted forms, right, so to not have to start from scratch. And so most recently, as I mentioned, we're talking with the Filipino Worker Center, LA Co-op Lab, and other LA-based worker centers to possibly create a Radiate Consulting Cooperative of contractors that work for the worker centers that would come together, right, as worker owners to do community organizing in the industries that they have been in themselves and are familiar with. No, so that's really exciting because that's sort of in the works right now. And I'll start wrapping up with just this one last slide to talk a little bit about how the challenges, or we're attempting to address some of the challenges that I mentioned at the beginning. So in the slide, you see that, for number one, it's really important to be able to develop a client pipeline from the onset to really have a strong idea of who the market is. And so a lot of that has to do with who we're partnering with. No, if it's a university, having contracts that are already available and ready for that co-op, for example. Number 2 and 3 really speak to the entity form and the structure and really making sure that the members are treated as owners and paid as owners, right, rather than employees. And the 4th is really, again, the importance of providing that back office support so that they're sharing costs. So it's more affordable than just doing things separately. And then, of course, just not having to worry about all the logistics, right, of running your own business, but that being consolidated and used by all of the members. So, we're really excited to be sharing this toolkit around the country and supporting the creation and replication of Radiate. But I do want to say that it's really incredible how we've seen a variety of different approaches to being innovative, to providing, the co-op model to immigrant communities. So we saw Center for Family Life right now has been gearing a franchise model, right, of Brightly's, which are cleaning cooperatives, and that's huge. That's a big lift. We see Cooperación Santa Ana in other networks of cooperative developers organizing a model to replicate consumer worker childcare co-ops. And then worker centers like PwC and Clean Car Wash organizing their members, right, and allies to create contractual relationships for the cooperatives. And so these are just some of the incredible ways that we're seeing innovation and a push to scale worker ownership as a tool for job creation for immigrant communities. And so, yeah, I'll just close with that. And I'm happy to answer questions alongside my colleagues here during the Q&A.
I just want to say briefly that we're really excited working with DAWI and LA Co-op Labs to be able to use actually what's been really created through Radiate LA to be able to then apply it to our Courage Homecare work cooperative to really strengthen and streamline our operations, and also to really build out the member administrator, so that we actually have the capacity to be able to grow in a sustainable, healthy way as a cooperative. And both, which is about also even streamlining costs in a way, you know, and just really systematizing how the operations run for smooth customer service, smooth decision making, and all of that. So we're looking forward to that.
Thank you all so much. What an interesting panel. I have so many thoughts, so many things I'd love to talk with all of you about. Very, very interesting and exciting work. So thank you so much for sharing it. And certainly you've probably seen in the chat lots of supportive and thankful words. I know that everyone's really enjoyed the session. There was one clarifying question. I just want to make sure that the person that asked it really has the answer. So in the LLC co-op model, all workers must be owners. There can be no employees. Is that correct?
Well, that's not correct. You can have employees. However, it's really that everyone being an owner, and that idea that you have to become an owner right away is really to get around the laws that say that immigrants that don't have working authorization cannot be employed as workers. But there is no law that says immigrants that don't have working authorization can't earn as business owners. So it's more like a fact of the condition of our community versus a legal. So because we could hire workers we could have someone as an employee doing something specific as long as they have working authorization, right? I don't know if you want to add anything, Vanessa.
No, that's right. Yes, there can be employees. It's just, you know, like just what Aki said, basically, we want to make sure that people that need to be owners can be. And so that has to do with how much control they have over their decision making, keeping it somewhat small, and being all on the board, right?
Yeah. Great. Well, we're out of time, but thank you so much. I hope we're going to hear a lot more from all of you about how this work advances and grows in home care in particular, and love to hear about the growth of Courage over the years ahead. So thank you all so much. An important note, we are all going to go back to the main session. This will be a little bit confusing, but you'll actually want to close out of this session and use your original link to log into the main session. We don't have a clean sort of click over, so you'll just have to shut this down, find your original link in your email, and join us back in the main session. So thank you again to all of our amazing speakers. That was so informative and inspirational. So thank you very much, and we'll see you all back in the main room. Take care.